The Accu joint system is a revolutionary new option for the treatment of greater and lesser toe arthritis. As arthritis develops, the smooth cartilage surface becomes worn and is replaced with scar tissue and bone spurs. These arthritic conditions often limit normal motion, resulting in a stiff joint that causes pain during physical activities such as walking or running. You may also have trouble wearing certain types of footwear. Two of the most commonly recommended treatments are joint fusion and joint replacement, but both of these treatments have limitations and lengthy recovery periods. Joint fusion locks the joint together with screws and plates, which eliminates the normal motion of the joint and often limits certain activities. Joint replacement removes a large amount of bone and replaces the joint with an implant that mimics joint motion. Because your full body weight is transferred directly to the implant, they can often fail or loosen over time. The majority of these procedures have severe limitations and reduce your ability to lead an active lifestyle. The Accu joint is different. The patented system is designed to resurface the bone by only removing the diseased bone and cartilage. Instead of replacement or fusion, the joint is resurfaced and maintains normal motion and function, meaning you can flex your big toe and wear the shoes you want. The patented design of the Accu joint transfers body weight onto the bone, not the implant. This allows full weight bearing on day 1 after surgery, which means you can get back on your feet quickly. When considering the Accu joint procedure, the surgeon should ensure proper rectus alignment of the joint as well as adequate bone stock for seating of the implant. In addition, the sesamoid apparatus should be completely free of all adhesions, and the dorsal articular surface recreated by removing any dorsal osteophytes. The incision is placed 1 centimeter medial to the extensor tendon using a standard soft tissue approach. Full exposure is required, more than normal, to gain clearance for the reamer. This will ensure smooth postoperative range of motion. If indicated, the EHL tendon can be lengthened or transected. It is important to use a McGlamry elevator to free up the sesamoid apparatus and reduce flexor binding. Release of these adhesions will aid in restoration of anatomic motion. Utilizing a saw, rasp, or rongeur, complete an extra-articular chylectomy and recreate the dorsal metatarsal head articulation. The opposing side trial is used to assess the size of the cartilage surface. For example, the concave phalangeal trial will be used to size the convex metatarsal head. Note that the phalangeal trial will vary 1 millimeter from the actual metatarsal implant. The implant should be sized 10 to 15% smaller than the outer diameter of the bone, and the stem positioned perpendicular to the articular set angle. It can also be used as a guide for insertion of the K-wire, and visualizing with C-arm is essential to ensure the wire is properly placed. 30 to 40 millimeters of the wire should be left exposed to aid with instrumentation. The reamer is placed over the K-wire. Care should be taken to avoid the flexor tendons. Use the reamer in the forward direction at high speed prior to contacting the cartilage surface. Constant light pressure will be the most effective method of resurfacing the damaged cartilage. As the reamer is advanced, the first stage will create a 360-degree recess 1 millimeter deep to accept the implant. The second stage prepares the articular surface surrounding the implant. A rasp can be used to remove any remaining osteophytes. The cannulated drill is placed over the K-wire and slowly advanced until the top of the counterbore is flush with the bone. The trial can then be placed to ensure 360 degrees of seating and contact on the bone. If more decompression is required, continue reaming no more than 3 millimeters, then repeat trial seating. If indicated, the optional step of reaming the opposing side of the joint can be completed to improve the articulation and range of motion. Ensure the alignment of the tap tool follows the angle of the pilot hole. Hand tap the pilot hole using the tap tool to its hard stopping point. Carefully hand thread the implant several turns to ensure proper alignment into the pilot hole. Use caution not to cross-thread the implant in the tapped hole. Complete the insertion of the implant using the T6 driver. Apply 2-finger tightness only. Do not over-tighten. If proper seating is not obtained, remove the implant and reinsert following the tap path to 2-finger tightness only. Rasp any remaining sharp edges. Check for smooth range of motion. The Accu joint is approved for use with bone cement. A complete flush and closure are completed, followed by a final check of range of motion. Post-operatively, immediate and full weight bearing is allowed using a surgical shoe. During the first 3 days, rest, ice, and elevation are encouraged. Further care will follow a normal post-operative protocol. Join AccuFix in the fight for function over fusion.